Good evening. I would like to welcome everyone to the August meeting of the Pitt County Board of Health. At this time, I would like to call the meeting to order. Attendance has been recorded by signatures. Do we have quorum?
Yes, ma'am, we have quorum.
Thank you. At this time, we would like to hear public comments. Do we have any at this time?
None at this time, ma'am.
Thank you. Next, we would like to move to approve the minutes from the July board meeting. I do realize that there's information that needs to be added to those minutes. I would like to approve the minutes as written if there are not any changes, and we will add the names to the minutes.
So moved.
First, do we have a second?
Second.
Does anyone have any objections? Okay. Minutes approved. At this time, we would like to move to the fiscal report to be given by Marcia Hall.
Hey everybody, hope everybody's doing well. It's nice to see you in the auditorium again. We're talking about the first period of the new fiscal year, the county fiscal year. The first column is the approved overall budget for public health at $13.989,791. We do have some budget amendments on the next county commissioner's agenda, and a lot of that is dealing with the COVID vaccine, but that will be for next month. But this is your overall budget as of the first month going into July. We did have a few budget amendments. Some of our state programs, when they send out the original AAs back in February and March, some things need to be adjusted because they're the month of June. One of our programs has a large amount of money that it's really hard to spend at the very end of the state, the last month of the county fiscal year and the first month of the state, since they overlap a month. The $26,000, I wanted to put your eyes on that for a minute. That $26,000 is a car for environmental health. The fund balance looks really large, but I wanted to bring to your attention that the county commissioners approved $612,000 for the new Smile Safari Dental and $150,000 for the phase 1 for medical records renovation. So that makes up part of that fund balance, along with the $26,000 for a car and environmental health. There's just a delay in receiving the vehicle, along with other car lots, I'm assuming. Overall current, that brings us to a little over $14 million. And that pro rata column, the fourth column over, is in a perfect world where we should be. The fifth column is year to date. So July does not look very well because we have to account for the accruals of the money that we did not receive for June. And our state funding we did not receive because it came in after the cutoff for the county physical reporting. So year to date, it looks like we're not looking too good, but with the timing items, county funding, we're just a little below $200,000 year-to-date adjusted. Did want to mention that July was the 3 payroll month that we always get caught up in. So we missed our state funding, we had accruals, and then we also had a holiday. Not to mention, we also are just doing the basic mandated services in the clinic. I also want to bring up that we had Medicaid transformation kick off July 1, and that's been lovely. And we are getting paper checks where before we were getting one deposit a month for our outreach programs for pregnancy care management and CC4C. Those two programs are now under new names, and we're getting paper checks, 2 checks per company that we are contracted with. We have received 4 of those checks so far, and we're expecting 4 more for the other 2 companies. So we've had a lot of growing opportunities the month of July. But overall, we are a little under $200,000, but I think we will level out next month when things all shake out a little bit better. Let's see what else. We are waiting on some contracts for some of our programs, our child care consultants. That is through Martin Pitt Partnership. They also support our Nurse Family Partnership Program as well. Those contracts just have not come through yet. And if I can switch over, I'm going to switch you over to the grant report. Grants, they roll. They're not part of your overall approved county commissioner budget. Oh, I did that. But we're looking good as far as grants. Some of these grants have not been spent because of COVID, but they just roll to the next fiscal year. We are sitting at $474,388. And I also wanted to mention to you, this is our position status. We are still about where we've been with 18 vacant positions as of August the 10th. The only other thing I wanted to bring up that I did not mention, our county funding is quarterly. I put that in. We will be receiving that payment the next month. Our roof, we thought we were in a good spot with it being patched. However, there was a downfall yesterday. It sounds like it was only across the river. I'm not sure if anybody else got rain, but we had a dark cloud over the health department for about an hour, and we found another leak. They have patched that as of today, but hopefully we'll have the roofing contractors come out, but that has been an ongoing, Buildings and Grounds are doing a great job keeping us plugged, but and covered, but we're a new leak every storm, it feels like. So, is there any questions about July?
Any questions for Marsha?
I do have a question. Marsha, is there anything that gives you any concern so far as we've started this new fiscal year?
No, I guess, Medicaid transformation has been interesting. Whereas we were getting one payment to cover these two programs together are probably not quite $1 million. And so before we were getting around $40,000 a month in one check, and now I'm waiting on the mail for 4 companies to send us the numbers. And I guess that kind of keeps me up at night a little bit, and seeing how this all is going to shake out with like the Medicaid cost study, and that makes me nervous a little bit. And I guess if we can get back to a normal, seeing people walk in the door, and offering everything that we possibly can offer, I think we will be good in the clinic. That just worries me a little bit. The rain has got to be holding up environmental health, getting out in the field, doing the testing and stuff. So I guess there's a lot of things that keep me up at night, but seeing how Medicaid transformation shakes out, it's got me a little concerned. But we just have a lot of work to do. And, with the Smile Safari, they actually are doing really well. We're hoping they go back to school, but they're staying very busy. We had a commercial on WITN, I believe. So they have been staying very busy, and I don't think they've even had enough time to start looking at, new vehicles. So, yeah, I kind of worry about our programs, making sure, for the past 2 years, they've not been able to travel and attend conferences and things, so they've been able to, with their state consultants, have a lot of leeway with buying different things for their clients. And so, yeah, there's a lot of things that keep me up at night, but you'll probably regret asking me that next time. I have a reoccurring nightmare, and it's me suffocating in a grain bin. And so, I know that's terrible, but that is when things are so busy at Public Health, I'll say, I'm having my nightmare. So they know that, but it's a busy place. But we've got a great staff, and we're, I guess, slaying the little fires that come up every day. We try to. With the roof leaking and all, we're still slaying it.
Well, I can't help you with the grain bin, so
I
good
know,
luck with
I
that.
know.
Thank you, I appreciate it.
It's been going on 4 years when it rears up, but yeah, that was probably way too much information, but.
Well, thank you, Marsha. You did a great job with the
Oh,
report.
you're sweet. Thank
and letting us
you.
know what was coming. I think we have an action item here.
Okay.
So, would anyone like to make a motion to approve the fiscal report as presented?
So move.
Second. Okay, does anyone have any concerns or objections? Okay, Pat.
All right. And feel free to email me if you get home tonight and you think about something. I'm happy to help with anything.
All right, thank you.
Thank you.
So the fiscal report is approved. Next, we'll consider items of old business, and there are none on the agenda. So we would like to move now to new business and have Mrs. Lee Cutler and her team come and present the communicable disease report.
Hello, everyone. Let me pull this up the right way. All right. Again, I'm Lee Cutler. I'm the communicable disease supervisor at the Pitt County Health Department, and I have my team with me to give their presentations as well. And Marcia, just so you know, next time you have that dream, look around in that bin, because you're probably going to see us all in there with you. I feel like we've been in that green bin for some time. And I feel like I was just here, like in December, giving 2019 reports. So hopefully we're getting back on track with all those reports. So again, we're here to give the presentation for the 2020 communicable disease for Pitt County, and we're focusing mainly on all the other communicable diseases other than COVID, because I know Dr. Silvernail pretty much keeps y'all abreast and up to date on the COVID information, but we'll touch on a little bit of stuff later on for COVID. So we'll just stick with the basic communicable diseases that are still occurring. They haven't gone anywhere. And again, just to not go into great detail about this, but for the health department, again, our authority is given to us. It's based on the North Carolina General Statutes, Chapter 130A, Article 6, which again gives us the obligation to report these communicable diseases, the ability to investigate the communicable diseases and issue the control measures that are relevant to them, and then to exercise quarantine and isolation authority for those respective diseases that may have those. And our main objectives with the communicable disease program is obviously to control the transmission and prevent the spread of these diseases within the community and give appropriate treatment and prevention measures. Other objectives are to detect the cases of the communicable diseases in the community and to monitor those trends to see where we might be going with those diseases. Some of the different services that our program offers, mainly the surveillance, again, of the reportable general and sexually transmitted disease, communicable diseases via the paper-based system and our NCADS, our electronic database system. And then also to provide prompt investigation of communicable disease cases, whether they're probable, suspect, or confirmed. They all have to be investigated in order to determine how they might need to be reported, and also prompt investigation and work within the outbreaks that are happening. Some other services, again, include our implementation of the control measures that may be relevant to each of those particular diseases, providing post-exposure prophylaxis, providing health education to the community to try to enhance people's, their education with it, and to be able to know what to do if they have a communicable disease, and to control those efforts. It also includes us maintaining our relationships and building new relationships between other public health entities, the private physicians, the hospitals, occupational health folks, just to be able to do the best that we can to try to prevent the transmission of diseases in the community. And we also have a 24-hour day, 7-day-a-week communicable disease response and reporting system built in, so that if something happens, someone's able to be gotten in touch with to go ahead and start investigating that situation. Our first program up is our sexually transmitted disease program, and Renee Williams is our sexually transmitted disease coordinator, so she'll update you on her goals.
Good evening, everyone.
I'm Renee Williams, and I'm going to present now for the STD HIV statistics for Pitt County for the 2020 year. First off, our STD program goals. Here in Pitt County, they are to monitor the STD rates and trends in Pitt County, ensure adequate treatments given to all patients that are seen in Pitt County by private and public medical providers, timely reporting to the state CD branch using the North Carolina Electronic Disease Surveillance System. Our STD program services include, at Pitt County Public Health Department, confidential STD exams, testing, treatment, counseling, referral for treatment as indicated. Looking at the 2020 STD case counts for Pitt County, we had a total number of 2,800 cases. Of that, chlamydia made up 67% of those cases, which is just slightly down from last year. In 2019, it was 2,232, and as you can see on the graph, it is 1,923. For gonorrhea, we are slightly up. In 2019, we were at 860 cases, and for 2020, we are at 880 cases, which makes up 30% of the total number of STDs in Pitt County. Looking at, it's not really, you can't really see it really well on this, but NGU, non-gonococcal urethritis, made up 2%, syphilis made up 1%, and PID was 0.01%. This is a demographic breakdown of the distribution. You can see that for females, out of the total number is 66% female, 34% male, the rest are listed. And that really hasn't changed much. Looking at the 2019 to 2018, it was 70% for women, 30% for male. So just only a slight change there. Now on to chlamydia. As I've already said, the number of the chlamydia cases did come down a little bit, not much. We were at 70% last year, 67% this year. So that was shown right here on the graph. And gonorrhea is showing that trend slightly upward. So even with COVID, we managed to have increase in gonorrhea cases for Pitt County. For the HIV Syphilis Services, Pitt County Health Department provides syphilis and HIV counseling, follow-up and referral, investigation and disease control measure violations, and syphilis HIV partner notification services. Looking at the HIV rates, we are trending a little downward from our 2019 data. We went from 47 cases down to 21. And the same trend was seen with our AIDS reported cases. We went from 18 to 11. Syphilis follows the same trend from 36 cases in 2019 to 22. Does anyone have any questions concerning those statistics?
Do you have any thoughts about the changes and what might be going on
As far as which,
with the increase in gonorrhea and the decrease in chlamydia?
no, that was a surprising
Yeah.
statistic and only found once collecting all of the data. I wasn't expecting that. I was expecting to see a downward trend with that as well, but just something to keep an eye on. CDC has changed the treatment guidelines this year. They only came out last month. So it'll be interesting to see what the trends are next year with this new implementation of treatment.
That's interesting. Thank you.
Thank you. Next up is Jessica Hardy, reporting for communicable diseases.
Hello, I'm Jessica Hardy. I'm actually the Women's and Children's Health Nursing Supervisor, but I was the CD coordinator way back in my previous life here at the Health Department. And I am just going to fill in for Christina Forget, who is was our CD coordinator, but now it is vacant, so we are currently advertising for that position. So the Health Department does a lot of back investigation on the back end. And a lot of that is not seen just because it's not up front in the clinic area. So we investigate the foodborne illnesses, the bloodborne illnesses like hepatitis B and C, and then the vector-borne illnesses that come from ticks. So these numbers actually only represent the newly reported cases. So we did have 8 newly reported chronic cases and 4 newly reported acute cases of hepatitis B. And I say that they only represent the newly reported ones because we do continue to get reports on the chronic cases of hepatitis B every time that they are tested. And then we have to go in and make sure that they're following their control measures and that there's no reason to contact that patient for any violations or anything like that. We also, same thing goes for the hepatitis C cases. These only represent the cases that were reported as acute, because acute is the only reportable hepatitis C in this state currently. They are, I think, looking at changing that to where chronic hepatitis C will be reportable. I hope it is not, because we are talking about a lot of people, and that's a lot of manpower that's going to go into that investigation. But the chronic that are shown on your screen are actually ones that were reported as acute by physicians, and we determined them to be chronic after our investigation because they were not having symptoms or they didn't meet the case criteria of the state. So the next 3 slides are the foodborne illnesses that we saw in 2020. And I do have a little tidbit fact after I get done with all 3 of these. So Campylobacter, we had 11 confirmed cases, 5 probable cases, 13 Salmonella cases and no probable Salmonella cases, 2 probable Shigella cases and no confirmed Shigella cases. So I did a little bit of math, and in 2019, we had 60 total confirmed and probable foodborne illnesses that were considered reportable. In 2020, we only had 30. So that was a decrease of half of the foodborne illnesses. I just thought that was pretty interesting to see that number. And I do know that in the Salmonella case definition, it jumped up in 2019, but that was because they made a slight change in what constitutes a positive lab. And so that we had more people that met that case definition in 2019. But I just thought it was interesting that it cut it in half in 2020. The next 3 are tick-borne illnesses. So the Rocky Mountain Spotted Fever actually did also change. I think it was either at the end of 2019 or the beginning of 2020, where the case definition, they changed the name. First of all, it's no longer called Rocky Mountain Spotted Fever. It's called Spotted Fever yeah, that one.
Rickettsiosis.
There you go. So they changed it from having a positive lab to now it has to be a certain level of positive lab. So not only do you have to have a fever with this, which did most of the time rule out that as a true case in the case definition sense, but now you added in this additional lab that it has to meet, and that took away a whole lot of our cases. So that's the reason that we only had 1 probable Rocky Mountain Spotted Fever in 2020. I don't think that COVID had anything to do with that. I think it was just a case definition change. Lyme disease, we don't really see a whole lot of. Again, we had in 2018, they changed the case definition, so that's why you had to jump from 17 down to 0. So they altered the case definition that you had to meet 2 specific lab values in order to be considered a probable or even a suspect case. But we had 1 of each, probable and confirmed, in 2020. And then ehrlichiosis, we didn't have anything. So I don't know if nobody was going outside too, but. And then we did also have some flu deaths. We had 3 adult flu deaths in 2020 and 0 pediatric deaths, which is also a drop from 2019 too. All right, now I'm going to turn it over to Lee Draper. Oh, do you guys have any questions? Sorry. Okay, I'm going to turn it over to Lee Draper. She's our immunization coordinator.
Thank you.
Hello, I'm Lee Draper. I'm the immunization coordinator at the health department. Our immunization program goal is to eliminate vaccine preventable diseases. We do this by reducing the spread of vaccine preventable childhood diseases by ensuring individuals are age appropriately immunized. We manage outbreaks of vaccine preventable diseases, and we provide health education to the community to improve immunization rates and protection via cocooning, which is having those around the baby already protected by vaccination. The Health Department provides immunizations at no cost to VFC-eligible children, which stands for Vaccines for Children, and certain immunizations to adults. Immunization for adults cost varies. We accept certain private insurances like Blue Cross Blue Shield, Medcost, Medicaid, and Medicare. We provide post-exposure prophylaxis for rabies, which is the vaccine that immunoglobulins provided at the emergency department. And we use the North Carolina Immunization Registry. That is the state's immunization program that all of Pitt County's pediatricians are on, and so are we. These are the vaccine preventable disease immunizations that the children get. This is the percentage of children who have documentation of being up to date by age 24 months with these 19 recommended vaccines. And then this is our 2021 goal for the health department. It's going to be 90%. The total for Pitt County, their goal is going to be 76. And then in 2020, our benchmark, we did meet our benchmark, and we did have 100%, and the county had 74%. Any questions? Next up is Lee Cutler for the TB program.
All right, so for tuberculosis, again, the main thing about tuberculosis is we're wanting to try to eliminate that as a public health threat. So our objectives mainly are to reduce the number of new cases of TB and then to control the spread of TB in the general population. And at the health department, we, again, provide the TB surveillance, case and contact investigation, and then direct observed therapy, treatment of contacts if they're not doing direct observed therapy, isolation, and other control measures for TB. For 2020, we had a total of 25, we saw and treated a total of 25 latent TB infections, and then we had a total of 2 new TB disease, TB cases, and so we followed technically only 2 cases. We didn't have any carryover TB cases from 2019 into 2020. So it was just the 2 new reported actual TB cases. So just to kind of highlight for communicable diseases what we did for 2020, I mean, I feel like we did a whole lot. I feel like we need about 50 slides up here showing what we did. But again, you know, COVID overwhelmed us with a whole lot of stuff, but we still continue to do our other communicable disease activities as well. So just to show some quick highlights, so we did our childhood immunization drive-through clinics, which was done on the curbside, trying to abide by the COVID regulations, you know, not having a lot of people inside. So we set up a curbside service where people were able to come through, be seen, stay in the car, and have their children immunized, and moved on, and it worked very well. We had our flu vaccine distribution, which we did that in the clinic, and then we did that as well. They had a lot of different community sites where they distributed the flu vaccine, trying to meet the needs of the community, because a lot of people didn't want to get out and about, so we were trying to come to them. We did a lot of COVID testing. We did a lot of COVID testing. And pretty much all of that was done on the curbside, whether it was done at the health department or at various sites within the communities. And that was done for most of 2020. We also gave COVID vaccines in 2020 at the health department. I think we got our first vaccines in, and we got them in on December 23rd, and we started immunizing on December 23rd. And so we weren't able, obviously, that we only had, a week to be able to give vaccines, so it was primarily in the clinic. We had not been able to get out yet into the community to go door to door or to do community sites yet. So that being said, our COVID-19 highlights for 2020, again, I think it might have been in March, correct me if I'm wrong, Dr. Silvernell, was when we received our first report.
March 19th,
March 19th is when we got our first report, and then started the interviewing and contact tracing, which pretty much took our whole communicable disease team, as well as some of the other nurses in there, because that was a large case. We did the COVID testing, again, in 2020, just at the health department, we performed 9,593 tests. That's a lot of tests. So, and then again, to touch on the vaccinations, again, we received it on December 23rd. Again, we vaccinated 172 people within that time frame from December 23rd to December 31st, but that was actually only vaccinating on 3 days, because the weekends and the holidays fell within that time frame. So, we've also, working with the school system. I've been the main liaison with the Pitt County, school system. And basically, that's just helping them and them helping us troubleshooting exposures and testing information, helping them, validate testing information for whether it's students or employees, knowing whether they need to be out or, when they can come back, or if they had the right type of test done. And then we also have a liaison with the Pitt County long-term care facilities, because there's a lot of reporting that has to be done with any outbreaks that are at a long-term care facility. And Christina Forget has been the liaison with the long-term care facilities, and will continue to be so. Again, like I said, it's a lot of busy work with that, because there's a lot of line lists that have to be kept up, and then you have to ensure that if there's another case within 28 days, then that outbreak continues. So until there's been 28 days with not another case, then you're continuing to monitor that situation. So not a whole lot of good has come out of COVID, but I can say one good thing that has happened with COVID has helped us to develop and enhance relationships with other community members. So who would have thought, anything good came out of COVID? But just, there's been so many people that we've worked with, but just to name a few, we've developed some really good relationships with the Pitt County Sheriff's Department, with EMS, with the Pitt County Schools, and with the Vidant School Nurse Program. So we've all worked hand in hand throughout this whole time frame, whether it's troubleshooting ideas, setting up testing sites, setting up anything that we needed help with. All these individuals were willing to help us, and I feel like vice versa, we were willing to help them with stuff. So that's been one really good thing that's happened with COVID for us, is developing and maintaining those relationships. So to summarize for our communicable disease report, the factors that impact the effectiveness, again, of our communicable disease control efforts are having ease of access to quality health care, timely access to health care for the community, having increased community awareness and education regarding the existing and potential health threats, and then community partner collaboration. And our main focus, which it seems like all of those are our main focus, and they always should be, because I feel like you can, even if you're meeting some things, you can always improve upon them. So our goals still have remained the same. Some of it's due to staffing, but again, I think some of it's due to just still wanting to continue to strive to meet some of your goals better. Again, increasing efficiency of clinic services, decreasing patient wait times, improving our outreach efforts for prevention and early treatment of diseases. And we hired a communicable disease health educator, which Georgia will be helping to do that community education. And again, this is just our staff here. As I think Jessica touched on earlier, our communicable disease coordinator position is vacant right now. So we'll all be filling in to meet the needs of that person and keep the job rolling. So does anybody have any questions?
What's the status of that job? Has interviewing begun, or have you had any candidates?
Has it closed yet? Has the position closed? Okay, we haven't had any candidates.
Oh.
So that's one of those things that either somebody really is interested in it and loves it, or people don't want to touch it with the 10-foot pole. So,
Gotta find that special someone.
there must be something special about all of us
Yes.
that work in this. Any other questions?
Well, hopefully somebody will come soon.
Hopefully so.
Soon. But I would like to thank you all for everything that you are doing.
Yeah.
And even with COVID, you were able to accomplish so much, so
Well,
much
thank you.
appreciated.
Thank you.
Does anyone have any questions at all for Lee and her team?
You know where to find us.
Yes,
Come up
we
with
know
some
where to
later on.
find you. This is also an action item. May I have a motion to approve?
So moved.
Second?
Second.
Okay. All in favor?
Aye.
Thank you. The report is passed. No objections. Next, we have a PrEP program presentation from Ms. Georgia Shirley.
Good evening, y'all. How are you
Good
doing?
evening.
You can tell I'm from the South. Okay, my name is Georgia Childs, and I'm with the Pitt County Health Department. I'm the PrEP coordinator, and I realized that my two slides, my first and second slide, are backwards. So if you'll bear with me, I'm going to hop through here to tell you what PrEP is, because some of you may not know. PrEP is pre-exposure prophylaxis, and that is the medication that prevents the transmission of HIV. And it is around 99% effective, so you can't get much better than that. Maybe 1% more and we'd be good. It is a pill that's taken monthly. We're actually looking at some studies now. There's a couple of studies up at UNC Chapel Hill that they're looking at an injectable. So we've got some folks who are actually local that we're kind of following, some patients that are participating in that particular study. So we're hoping to get some good reviews and good information with that as well. So I'm going to back up, and you all actually, you might not remember this, but you all actually approved for us to have this grant from the Department of Health and Human Services for North Carolina. Probably approved it back in early 19, if I had to guess, and then we had somebody in the position, and then they were not in the position any longer. And so we are trying to basically improve access to PrEP services. This particular position serves 11 counties in eastern North Carolina. I feel very fortunate as a Pitt County resident to be able to work here in Pitt County and have it here kind of as our hub. So you can see on the screen the different counties that we're working in. And I'm going to tell you a little bit about what we're doing with this program. So the people who are eligible for PrEP are actually anybody who is at high risk for HIV. And as you saw the communicable disease team talk about the STD rates here in Pitt County, it kind of mirrors North Carolina and the nation for that matter. So you can see some of the rates are going down, but that doesn't mean that we need to stop trying to figure out how to prevent some of these diseases from continuing to spread. So with HIV, we want to make sure that even though some of those rates are a little lower, they're not gone. So we want to make sure that we can provide that service here in East North Carolina. Currently, there are a few places that do offer it, and I'm going to tell you a little bit about that in just a second. The primary focus for this particular grant here in the eastern region, eastern part of the state, is young African American men having sex with men. Now, when we started this, that was the major group that we wanted to target because we know that that is a very high-risk group. We also say anybody who's at high risk for HIV, and that's why that first bullet point is up there, because we want to make sure that anybody who is at high risk and engaging in any kind of risky behaviors, we can try to help mitigate the spread of HIV. So, once the position came available from fall 19 to spring of 20, the position was vacant, and then I came along in March of 20. And what was that date again? March 19th? And I started on March 30th. So walked right in the door and, hey, COVID, welcome. We're so glad you're here. So we went into COVID response mode, and that happened across the region, across the state, and the nation, of course. And so the county health departments that I was working with in these counties, they all did the same thing we did. They went right into COVID response. So it's kind of like, PrEP's on the back burner. We're not going to do anything. So what did we do? Good health educators. We helped the communicable disease team. We ran the call center, that kind of thing. So there was a lot of stuff that didn't get done. So that's why we're kind of behind. That was my point in that, is we're behind because of COVID. So we did have to put that on hold for 16 months. But finally, Amy Haddam, my supervisor, said, you got to get out of here. You got to go. So I was able to go once the health departments opened up and start really talking to folks. So moving into how we're prepping for PrEP in Pitt County. The Personal Health Division actually is going to have staff training on August 24th and 31st for their particular division, because the PrEP program will actually run through the communicable disease clinics. So they have to get trained on all things PrEP. Some of them don't know what PrEP is. Some of them are hearing about it similarly to, as you guys for the first time. Dr. Christopher Hurt is at UNC Chapel Hill, and he actually is the director of the North Carolina HIV Training Center. And he's been very gracious and very patient with us in helping us get our staff trained. So they will be conducting those trainings, hopefully for our services to start in the fall. I know I'm flying right through this. So these are the places right now in Pitt County that are or will be, or I should say in our region, are or will be offering PrEP services. So the ECU Adult Specialty Care Clinic has been offering PrEP services for quite some time. So we have been in our region been able to refer people over there. A lot of it is based on insurance, and so if somebody doesn't have insurance, then they're having to pay an exorbitant amount of money out of pocket. So that's part of what this grant can help do, is reduce those barriers to having folks pay. So if they can come to the health department, they can obviously, on a sliding scale, pay little to no amount to be seen. And then, of course, with the medication, we have something with Walgreens Specialty Pharmacy where they work through Gilead Sciences to be able to offer access to care to the medication also. So some people will be able to get their medication for free. And PrEP is a very expensive medication, so we're happy to be able to have that partnership, to be able to offer it here in Pitt County and in Eastern North Carolina to patients free or no cost. Vidant Medical Center, they do have a physician who moved over from Physicians East. I'm not sure how many patients he's seeing through the hospital at that point, so we don't refer many to him. And then I've got Lenoir County Health Department on here because we're in a race with Lenoir County to see who's going to get PrEP services done first. And I was on a meeting this morning and we decided some of us are really competitive, so we're going to try to make sure Pitt County is first in doing that. And then ECU Student Health Services, they've been working on it for a while actually, and they're going to start offering those services to ECU students. So we know that we'll see some ECU students as well because they don't want to be seen maybe on campus, but they can come over to the health department. So we're looking forward to serving those students as well. Any questions? I flew through that, I'm sorry.
That's okay. Does anyone have any questions for Georgia? Okay.
All right. Thank you so much.
Thank you. Next, we will have our health director's report by Dr. Silverman.
Hey, first, thank you to my staff for excellent reports. We accepted the PrEP grant shortly after I started in 2019, and every case of HIV we can prevent is a victory. So glad to see that getting off the ground. For those of you who watched the Board of Commissioners meeting last night, some of this will look familiar. I want to start out Delta. Delta is clearly here in Eastern North Carolina. This is a slide out of the Brody sequencing program. 95% of sequence samples were Delta. The new report came out, a little bigger sample size, still 95% Delta in the sampling and sequencing that's going on. This is our epidemic curve as a stacked bar graph by week by week. If you look, we hit our low point the week of June 19th. After June 19th, we started to edge up and then really took off after the first part of January, and that correlates with July, excuse me, correlates with the arrival of Delta here in Eastern North Carolina. This is a chart I steal from Bill Cleve. Don't tell Bill I stole it from him, but he said I could use this. This is the hospitalizations in Vidant. So this is last week's chart where they were at 66. By Friday last week, they were in the high 70s, 76, 78 cases in the house. And when Bill sent out his report this morning, there were 100 folks in the hospital this morning. So that curve has continued to go steeply up in hospitalizations. There's been a corresponding uptick in ICU admissions and ventilator admissions as well. Overall, I think the good news in this graph is how flat the ICU curve is in comparison to the admissions curve. And what that tells me is that we're doing a better job of treating these folks and keeping them out of the ICU and off of assisted ventilation devices. This is our epi curve by age. And again, as you look at this, you can see since that week of June 19th, we've seen considerable growth in the younger age group, the 0 to 17, most of whom are not eligible for vaccination. We've seen some growth in the 18 to 24-year-old group. Where we've really seen the growth has been in that 25 to 49-year-old age group, the young healthy worker group, which we know has been a problem. Many of them don't see COVID as a risk to themselves. They feel that they're at low risk for severe outcome from COVID. Vaccination in that group, when you look at it as a percentage, they're actually slightly over-vaccinated as a proportion of the population, but we still have some work to do in that age group vaccination-wise. So seeing growth there. And then this, the older workers, the 50 to, or maybe I should say more mature workers, the 50 to 64-year-old group, we're seeing some growth in that group as well. This is our epi curve, or our testing curve. You can see early on where there was little testing, and then at the height of the epidemic or pandemic back in January, we did almost 10,000 tests in a single week across all providers in Pitt County. That fell with demand and with recession of COVID, and again, testing has gone up to where we're approaching 4,000 tests a week again in the county. So good capacity for testing in the county. Unfortunately, with that, our percent positivity has also risen. This is maybe a little less reliable with smaller sample size, as a small sample with a high rate of positivity can skew that average up. But even with that, this is clearly, percent positivity is clearly rising as well. Last but not least, this quick look at our numbers from yesterday. We had, through the last 14 days yesterday, 1,016 cases. That was a rate of about 5.5 cases per thousand. Looking at the numbers today, and I'm sorry couldn't put these in, I had to turn the slides in before the numbers could be updated to get them into the system here. So today we're up to 5.7 cases, so continuing to rise on a per thousand basis. That's we were at 1,054 cases today over the last 14 days, an average of 75.3 cases per day. Our total cases are at 22,136 as of today. The slide shows yesterday's number. It's about 12% of the Pitt County population. Recovered number, we're still at 95% in our case count today, 20,955 folks. Our case fatalities, and we had been riding with 96 fatalities since May. And obviously a fatality doesn't recover, so we know that data is dirty, data is always reviewed, data is cleaned. At some point, what I suspect has happened is that they found a case that was assigned to us really belonged to another county, and they withdrew that fatality from us. So we stand at 95 public health surveillance case definition meeting COVID fatalities as of today. And our case fatality rate is at 0.4, unrounded 0.43 as of yesterday, unrounded today 0.42, so trending downward in spite of upward trending cases. So that's good. Percent positivity 14% plus yesterday. Hair down today, 14.3% today. I would stress, to go back to the fatalities for a second, the state has given us a surveillance definition that includes having a positive COVID test. That can be a PCR test, a antigen test. The individual must have a clinical syndrome compatible with COVID. There must not be a period of recovery between the test and the fatality, and no other obvious cause of death. So we did have one case in the county where an individual had COVID but died of a gunshot wound, and that death was not listed as a COVID death. It was listed as a gunshot wound death. So we have tried to apply that case definition as given to us and sort through these. Some of these classifications are difficult in that some of the folks from the nursing homes before we got them vaccinated, some of these folks were very ill to start with, got their COVID, actually recovered from their COVID, went back to the nursing home to die shortly after the nursing home. Some of those we've looked at and said weren't COVID deaths. The state has looked at them and said they were COVID deaths. So there's, even amongst epidemiology staff, there's some disagreement sometimes on the classification of those. So at the state level, there's been a tendency to reclassify some of our deaths. And the last time we had a big jump, that was the state adding a few deaths in that they felt should be classified as COVID deaths. So kind of a quick talk. If we have 2.5 cases more, or 2.5 cases times the cases, when the state was at 10% positivity in terms of a percentage of the population who had had a COVID test, meaning a PCR test or an antigen test, there was serosurveillance data that's in a project that's run across several of the universities in the state, including ECU, and that data was showing a 25% seropositivity rate when our COVID testing data was showing a 10% positivity rate. So it's believed, and Zach Moore has said this, and then Dr. Tilson, Betsy Tilson, State Health Director, came out and said this, for every case you've counted, you've got 2.5 cases that you haven't. So if we were to take those 22,066 cases, multiply it by 2.5, we get 55,165 cases. So that means that there's 30,000 plus cases out there that we didn't know of. So again, that base of the pyramid of the infectious disease, the mild or asymptomatic cases, that also reduces our case fatality rate dramatically and takes it down to 0.2 rounded or 0.17 unrounded. So perhaps maybe not as great of a threat to produce death in individuals as we originally thought. I will say if you do age-adjusted death rates as you get higher in the age brackets, the death rate climbs very drastically, and at one point I had done that, and the over 75-year-old group had an age-adjusted death rate of 8.5% for 75 and older. So this is the global death rate, unage-adjusted across all ages. Moving on, our vaccinations, again, numbers don't change much on a day-to-day basis in vaccination. The raw numbers were up a hair today, which is good. We continue to creep up in our numbers being vaccinated. We have seen some increased demand at the health department for vaccinations. Right now, 48% of the county is considered partially vaccinated. 44% of the county is considered fully vaccinated. So lagging a little bit comparison in some parts of the state, but making progress, slow progress there. COVID reproductive number. This applies specifically to the Delta variant. The reproductive number is the number of cases. You'll hear it sometimes referred to as R0. Wasn't sure how to make an R0 in PowerPoint, so I talked about it as the reproductive number. The reproductive number is the number of cases you get for each case of an infectious disease. And at the governor's press conference a week or so ago, Dr. Cohen suggested that for the Delta variant, it is up to 1 to 6. So if that is true, it's a very steep geometric climb, and I've shown you the math there on the slide. So one case would give us 6, 6 would give us 36, to 216 to 1296, and so on. So a very steep climb in cases. That's without some sort of intervention in there. Now again, we're in a pretty good place in the county in terms of vaccination. And then there's also natural immunity from the number of folks who've had it. So we're in a different place than we were last year at this time. We'll talk about protecting Pitt County employees. The county manager asked myself, the county attorney, to discuss whether we should return to some protective policies in the county. We made a recommendation to resume modified masking in the county. That masks should be worn by employees when they're within 6 feet of each other without some sort of physical barrier between them. This was approved at the Board of Commissioners meeting last night, and the manager sent an email out to all county employees today. We talked about vaccination. Many employers are choosing to mandate vaccination. There's some appetite to mandate vaccine, but maybe not completely mandated for employees. So we tried to split the difference on this one and are going to model a policy based on the OSHA hepatitis B policy that requires the employer to offer the vaccine to all employees, but employees are not required to accept it. Employees who decline will sign an informed refusal, a declination of the vaccine, which they can rescind at any time and receive the vaccine should they change their mind with no penalty. Those employees who do not accept vaccine will go into a surveillance pool and be tested on a weekly basis to make sure that they are COVID-free. And there's some consideration with Breakthrough and Delta, should we include all employees in that pool? And that's yet to be discussed. But we were tasked with writing that policy and taking it back to the commissioners for approval on the 23rd. So the manager and the attorney and myself will do that. Staffing updates. Hey, as you just saw, my CD supervisor rescinded her resignation and has decided to stay with us, which we are very happy about. Don't blush too badly. I can't overstate the importance of having this position filled, especially heading into this Delta wave of COVID. Onsite wastewater, we're still struggling a bit here. We are working on one offer. We hope that individual is an experienced individual will accept. We have applications in the pipeline for 2 additional on-site wastewater positions. And we have one position that's going to be kind of a hybrid position. We have, in the county, developed so many pools that need inspection, so many public pools that need inspection, that we are working to create a position that will primarily be assigned to do pool certifications, pool inspections, but then will be an on-site wastewater backup person. And we're still tweaking that with the State Office of Human Resources to get that job description squared away, and then we'll get that posted. But making some progress there. I should mention under the clinical personal health division, we have hired a new physician extender who will be joining our practice 31st? August 31st, yes. So we're very happy to welcome that individual aboard. The roof issues, when I put this slide together, I didn't know that the roof had leaked yesterday. Marcia was right. Man, it poured cats and dogs, the proverbial cats and dogs yesterday. No offense, Dr. Hayes. Love cats and dogs and other animals. But it really rained hard at the health department. At one point I was in my office and I could hear what sounded like rain on the roof, but I couldn't see, it was not raining out of the west side of the building. And it was weird, it still looked pretty clear, and then it moved far enough over that it started coming down. And I mean, it came down in buckets, so I didn't realize that it leaked yesterday, Marcia, but in the lab, oh great. So our county engineer, Tim Corley's been out, done a walkthrough, looking at some things. He's been bringing the contractors around to get a bid on the roof, and we are going to get a new roof, apparently with the ARP funding. We just need the rain to stop long enough to actually get it done. So one of those that issue has been improved. Staff mental health, talked about this last month with you all. Last Friday was our general staff meeting. I reviewed that study directly with our staff last Friday. Encouraged them to seek help if needed. After that, Jennifer Dickerson, our human resource officer, resent out the EAP contact information and information for Dr. Lamson's program. As I walk around, I see a lot of folks are tired, a lot of folks are fatigued, COVID fatigue. We suffer from COVID fatigue just like everybody else, but I think staff morale is good, and folks mostly seem happy in their work, so in spite of the challenges of the times. I do remain concerned about staff, especially heading into this Delta wave and what we don't know will come with this. While it appears to be certainly more transmissible, we're not sure about how this is going to affect mortality and morbidity, but certainly it's more transmissible than previous variants. Data fidelity, we talked about this a little bit last month as well. Shortly after our last Board of Health meeting, we discovered a lab transcription error. Positive chlamydia test from State Lab of Public Health was entered as a negative in EPIC. This was caught by staff in the NC-EDS system, the state reporting system, and the patient was treated, but a short delay in treatment did occur. Had that data been transferred electronically, this transcription error wouldn't have happened. So I think we really need to put some pressure on the state to get the State Lab of Public Health to report results electronically and not on paper. Would appreciate your help with that, folks. And then finally, consider the following. When COVID started last year, we had limited testing, little experience treating the infection, limited or no treatment options, no vaccine in a population that was COVID naive or non-immune. And, we stand here, a year and a half into this. We have ample testing. We have the capability in Pitt County to do almost 10,000 tests a week. We have in-home testing that's available. You can buy in-home testing. We participated in that Say Yes to the COVID Test program, pilot tested in-home testing here. Still getting requests for that. I wish we had more of those kits to give out. We do not right now. We're looking at some other options for take-home tests that we can give out. But there's bountiful testing available across Pitt County and across our medical infrastructure here in Pitt County. We've gained a great deal of experience in treating COVID infection. As I said, when you look at that Viden curve that shows hospitalizations versus ICU admissions, there's a separation, and the ICU curve really stays pretty flat. And that says that we're doing a good job of treating these folks in the hospital and keeping them out of the unit, which is good for everybody. There's several therapeutic options. There's a couple of monoclonal antibodies. There's remdesivir, desrecinivir, and now we have 3 safe and effective vaccines on the market, which we continue to administer to folks, even though our uptake is a little softer than we would like. And our population at this point, 44% fully vaccinated, and somewheres with 11 and 30% who have had the disease and have at least some degree of natural immunity. Natural immunity has been largely ignored throughout this, but it's probably at least as good as vaccine-produced immunity, if not a little bit better. And while there's questions about how durable both of those things are, if your body has seen this virus before, you're likely to have some protection going forward, whether that's from vaccination or having had natural disease. So from a population standpoint, we're in a different place than we were a year and a half ago, and that's a good thing. And so my final comments, this is not a no-win scenario. I don't believe in the no-win scenario, and we're going to beat this darn thing and chase it the heck out of Pitt County. Thank you, folks.
Thank you, Dr. Silvernail. Does anybody have any questions for Dr. Silvernail? I have one, actually. You asked if if we could help with the data transfer issue, the data fidelity. What can we do to assist with that?
I'm wondering
Is
if
it
we sent a letter to, whether that goes to Mark Benton, someone high up in the state health department, and/or Scott Schoen, who's the laboratory director at State Lab of Public Health. I think that they need to hear that we need these things transferred. Not only is there the fidelity issue with mistranscription, there's the time issue. In that, we send many of our samples to the state lab because there's no charge for us. There's no charge back to us or no charge back to the patient. We do use the commercial labs for some things. We use the hospital lab for some things. But when these reports come back, there's time on our end to process these labs and then enter them into Epic. And then there's the whole potential for transcription errors when they're entered. So I really think that the same state that recommended we have an electronic electronic health record, I think the state should be reporting into our electronic record directly. So I think a letter from the board would be helpful on that.
Okay, so if you could help us with the content of
Absolutely.
the letter, I think we can probably
Absolutely.
do that. Do I have to have any action here, Betsy, or just hold until the next meeting?
Okay,
All right. Thank you.
great. Any other questions, folks? All right, thank you for your time.
Thank you.
Okay. With no other business on the agenda, do we have a motion to adjourn?
Could I make a comment?
Sure.
Yeah, just I don't know how many of y'all paid attention to the Board of Commissioners meeting last night, but 2 items came up that were relevant to this body. And one is that there is a proposal now that members would receive a compensation. The chair would get $75 a meeting, and members would get $50 a meeting. You shouldn't start spending that yet. It would go into effect at next year's budget, and that's in July. And the other thing that would concern possibly in this body would be a discussion about a metal detector at that door. And I think that's an ongoing discussion, and you might be hearing more about that. There is a report that will come back to us at a future date. But if anyone has any concerns, they should take a chance and voice those concerns about security in this building.
Who would we voice those concerns?
To Scott, we have I forgot the gentleman's name. We have a risk assessment person, and I believe that person will be in contact with all of the boards that meet in this building. So the discussion was about whether we would have a metal detector, where it would be, whether we would get increased officers at our meetings. I don't believe that y'all have an officer here. So this is a good time. If you have any of those kinds of concerns, you should, I think you will hear from this risk assessment person, but certainly no harm in going forward to Scott.
Thank you for sharing
Sure.
that. Okay. All right. Are there any other comments or items that we need to discuss? No? Okay, thank you. With no other business on the agenda, do we have a motion to adjourn?
I move that we adjourn.
Thank you. Second?
A second.
All opposed or all in favor?
Aye.
Thank you. Meeting adjourned.